Asim, I wouldn't publicize this if I were you. You're only going to make yourself enemies. And I want to do whatever I can to help you get a job back in the NHS, right? Because by this stage, I wasn't working in the NHS. I was only doing private care. And I said, Prof, what about our duty to the public and to patients? No answer. Why am I telling you this, Joe? Remember earlier on I talked about the so-called psychopathic determinants of health?
Yes.
There is a cultural problem in our profession where people are afraid to speak out for their patients, even if it's something that's important and true. So what does medicine become when doctors can't even speak the truth? But I didn't care. For me, this was more important than anything. So I got this out, and it became a news story, and I was interviewed by the BBC, and it was a big, and after that, all these stories start coming out, I made this so-called injustice visible through the mainstream. But it still bugged me. How did my dad have a cardiac arrest? So his post-mortem findings came back. And two of his three major arteries were severely narrowed, right? Critically narrowed. 90% in what we call the left anterior descending artery, the most important artery to the heart, and the right coronary artery. And I thought, this is weird. I knew my dad's lifestyle inside out. I knew his cardiac history inside out. There was no cardiac history. He had something called a calcium score done a few years earlier. He had blood flow to his arteries were all normal. This is a guy that only 2 years earlier on a badminton, I was Manchester champion, schools champion in badminton, right? Singles badminton, I don't know if you've ever played it, but it's like playing basketball. For your cardiovascular system, it's really heavy. And for the first time in, God knows, probably about 30 years, he beat me in the first game 15-1. And I was like, my God, how is my dad beating me here? We were very competitive with each other. I mean, we played for an hour, and almost at the end of the hour, Joe, I got back in, it was like tied. I ruptured my Achilles, right? It was that bad. And I was about to tweet and just share, I'm really proud of my 73-year-old dad. He literally almost beat me in badminton, right? He was that fit, so it didn't make any sense. So, severe narrowings, and I'm just, okay, what was it? Was he really stressed? Stress, by the way, severe psychological stress can cause these sorts of issues with the heart, but again, didn't buy it. And then October, November 2021, I get alerted from a cardiologist friend of mine who's one of the smartest cardiologists in the country, I think. I mean, he's a brilliant mind. And he sends me an abstract from Circulation, cardiology journal, done by Stephen Gundry, who's a cardiothoracic surgeon, I think, based in New York. And I read this abstract, and I'm like, wow. And what he found was he'd been following up several hundred people in their 50s with a test that he does called the PULSE score, which correlates the blood test, and it measures markers of inflammation in the blood, Joe, which have been validated and correlated with heart disease risk and heart attack risk. And what he found was that within 8 to 10 weeks of these patients taking the Moderna or Pfizer vaccine, mRNA vaccines, those markers of inflammation in the blood had increased to a level where their risk of a heart attack went from 11% at 5 years, just within 2 months, to 25%, which is a huge jump. Like, to give it context, if I today decided I was going to smoke 40 cigarettes a day, eat junk food, hammer it all night, not sleep, stop exercising, I couldn't even get close to increasing my risk that much in 2 months. Now, it's one bit of data. And of course, in medicine, which we've talked about, is not an exact science. You never rely just on one bit of data. You look at other bits of data as well, and what kind of picture does all the information start painting? So at that point, I was like, okay, now I can understand. There's something now that fits with what happened to my dad. But if this is real, this is going to be a problem, because I know you're essentially, for populations of people who may not know they've got a little bit of mild furring that isn't going to cause them a problem for 20 years, suddenly you're going to get an increase in heart attacks much more quickly. Then what happened was I got contacted. It all happened within a few weeks. A journalist, I think it was from the Telegraph or the Times, I can't remember, asked me to comment on the fact there'd been an unexplained increase, about 25% increase in heart attacks in Scotland in hospitals that people can't explain. So they said, Dr. Malhotra, what do you think's going on? And then the third thing that happened was I was a whistleblower from a prestigious university in the UK contacted me, cardiologist, and he said to me, he was very upset. He said, it seems something I've got to tell you. I don't know what to do, but I need to tell you this. I said, what is it? He said, this research group had accidentally found with the use of coronary imaging techniques, so this is specialized high-tech scans of the arteries of the heart, that in the vaccinated, there was increased inflammation of the arteries of the heart, and it wasn't there in the unvaccinated, which again would increase heart attack risk. But they had a closed meeting and they said, we're not going to publish these findings or talk about it further because it may affect our funding from the drug industry. And at this stage, Joe, I was like, okay, now I've got 3 bits of data. There's enough here for him to at least ask the question. So I go on one of the more semi-mainstream news channels in the UK is called GB News. And I went to them. I said, listen, something I want to talk about. I said, I'd done stuff with them before. And they said, come on, let's talk about it. So I talked about this on GB News and it went viral, And I didn't say stop the vaccine or whatever else. I said, listen, there's a signal here that needs to be looked into. We've got these unexplained heart attacks happening. We've got this evidence from circulation